Hi everybody, today we're going to take a look at the heart models we have and look at some of the main chambers, valves, and the blood vessels associated with the heart. So first of all, let's identify left and right. Remember the pointy part of the heart, which is your apex, is always pointing toward the left, and therefore this is your right side and this is your left side. So what we have here is you have your right atrium up here, your right ventricle down here, your left atrium up here, and your left ventricle down here. An easy way for you guys to identify is the blood vessels that are running right in the middle of the heart, which will help you identify again separation of the right ventricle from the left ventricle. Now the blood vessels that are coming into your right atrium is this big one right here coming from the top. That's your superior vena cava. And the one you see down here with number 4 on it, coming also into the right atrium, that's your inferior vena cava. So superior vena cava and inferior vena cava both empty into your right atrium. And then if you take this off, here is again your right atrium going down. This is space right here, this cavity right here, which is the same thing as this, would be your right ventricle. Notice that there is a valve between these right atrium and right ventricle. This valve right here has 3 flaps and therefore called the tricuspid valve. You also see these little strings coming off of this valve. So if this is your valves, these are the little streams or connections. These would be referred to as the chordae tendineae. Going to this side, again here is your left atrium. This valve right here would be the bicuspid valve, also known as the mitral valve. Again, little strings coming off would be your chordae tendineae. And you can see chordae tendineae is actually connected to these little protrusions or finger-like protrusion muscles. These muscles are called the papillary muscle. Now the cavity itself, this cavity which is much larger, that's your left ventricle. The separation between the right ventricle and left ventricle is this muscular structure called the interventricular septum. Now coming into your left atrium, you have two blood vessels right here on this side. And if I turn the heart this way, you also see these 2 on the back. So these 2 and these 2 are all 4 emptying into your left atrium. They're coming from your lungs and they're coming back toward the heart, so they're referred to as the pulmonary veins. So these 2 would be your left pulmonary veins, and again if I turn this around, these 2 would be your right pulmonary veins. Now when the blood comes into the left atrium, it passes through the bicuspid or mitral valve, it goes through your left ventricle, and then it's going to be pumped through the body. So before it does that, it needs to pass through this valve right here. So this white structure right here. This is called the aortic valve. And then passing through this valve, it's going to go through this large branch that you see right here that's curving in red. That would be your aorta. Now blood comes in, it first goes up. So this part sometimes referred to as the ascending aorta. This curvature is called the aortic arch. And then you can see that the aorta is now moving downward. So this part again continues to go behind the heart, and it's called the descending aorta. There are 3 main branches coming off of your aortic arch. The first one that branches off is the brachiocephalic artery. The second one is left common carotid artery. And the last branch is the left subclavian artery. Now looking at the right ventricle. Right ventricle is going to pump blood to your to your lungs. So to do that, as this chamber, yes, it's relatively small, contracts, it passes through this valve right here, called the pulmonary valve, and then pushes blood out through the pulmonary trunk right here. pulmonary trunk is going to form two branches. One's going to your left lung, so your left lung would be here. So this is your left pulmonary artery. And again, the other branch is right here. That would be your right pulmonary artery. So left pulmonary artery going this way, and then right pulmonary artery poking this way, going to your right lung, so right pulmonary artery. Let's see, if you're looking at your heart, again, the pointy part of your heart is the apex of the heart. The part where all of the blood vessels come out, that would be your base. You see this little ligament right here, number 12 in white, connecting the pulmonary artery to aorta. That's called ligamentum arteriosum. And this was part of the fetal circulation, which we will talk about when we talk about cardiovascular system. Now, looking at the surface of the heart, what we have here is we have the blood vessels that are coming from the aorta and supply the heart itself. So you have one branch that is kind of hidden right underneath the left atrium, right here, and it's not the best model. Now, when this branch comes from aorta, comes underneath and gets here, it forms two branches. This main branch, one goes right here in red, you see right here between the left atrium and left ventricle. And the other one comes right in front of the heart. So, the original branch that's coming from the left atrium, from the aorta to here, that branch is called the left coronary artery. This is gonna branch to this one and this one. So this branch right here is called the circumflex artery, which actually goes to the back of the heart. And then you have the one that runs in front, that is called the anterior interventricular artery. On the right-hand side of the heart, again originating from aorta, you have this main blood vessel, that's your right coronary artery. So here was the left coronary artery, this is your right coronary artery. And then looking in the back, you have, if you kind of look underneath the heart, right here you have this big blood vessel that runs right in between the two ventricles. This red one right here is called the posterior interventricular artery. So posterior versus anterior interventricular artery. Now, to collect the blood, there are multiple blood vessels. One of the main ones I do want you to know is this big one that is emptying into the circulation or the right atria. This is called the coronary sinus, and basically collect deoxygenated blood from the surface of the heart. You also have the parallel one right here next to the anterior interventricular artery. The blue one that is depicted here is called the great cardiac vein, which is again goes to the back and eventually empties into the coronary artery. These are not the only branches that you need to that we have on the heart, but these are the only ones that I need you guys to know for your exam. Okay, that's it.